All right, hello and welcome everyone to the Friday Media Update with Mendocino County Public Health. We're here with the County Health Officer, Dr. Andy Coren. We'll get all the latest updates on infectious disease and other public health related things. Then we'll jump into taking some questions from the media and the public, whoever's listening in. If you are on the YouTube live stream or Facebook live streams, you can leave questions in the comments section, or on YouTube, it's also the right-hand side in a live chat section. So leave your questions for Dr. Coren there. And let's see, we have about an hour, so we should be able to fill it up pretty nicely. So let's jump right in. Dr. Coren, I'll hand it over to you.
Okay, thank you very much, Ken. So before I start the update this week on the current status of infectious diseases for our community, I wanted to briefly acknowledge what we've gone through this past year and thank all of those in the health department, the county and city and tribal governments, the clinics, hospitals, healthcare workers, the schools and staff, the community, religious groups, lodging, restaurants, and other store owners, ranchers, farmers, and especially all the employees and independent contractors. We have had and will continue to have our differences, but how we pull together to keep our communities safe and healthy. We have been in a pandemic that was a once in 100 years event that claimed more American lives than all of the wars since 1900. We may not be over quite yet, but I just wanted to thank everyone for your contributions and wish you all a happy and healthy holiday season and new year. So now let's briefly review the infections in California and Mendocino County. Mpox is decreasing. Vaccines are available, including second shots for the series. And if you think you need one, please request it from your provider. Ebola virus is still contained within Uganda, but it is an international emergency due to the severity of that disease. In the United States, all passengers coming in from Uganda are to be funneled through 4 airports and then hospitals for screening. All patients going to all medical facilities and clinics in California should be screened for their travel history, and they have all been informed to do so. We are now in our usual winter virus season. It is unusual for the arrival of 3 major viruses at the same time. Next slide, please. RSV, which in October and November stressed many of the California hospitals, including our own, due to the demand for pediatric beds. This outbreak has peaked and is decreasing now, as you can see on this slide. The 2 lines that curve downward that are connecting red dots. The dotted line on the bottom is adults who were admitted to the hospital with excuse me, these are not admissions hospital, these were clinical laboratory specimens. So the bottom line is adults, and the top line you can see is the pediatrics, and they have really peaked, and they're coming down, which is very good, thankfully. There is a possibility, according to state modelers and so on, that it could rebound, but we don't have any long-term data that shows that. So far, it looks like a very nice trend line that we're decreasing in the cases and also hospitalizations. The next slide shows the multitude of viruses affecting us now, and that is usual at this time of the year, but the main and growing burden is from influenza and COVID. So you can see on the right all the different viruses. The enterovirus is the large green line that peaked around August and September, and it is coming down and has been. The RSV is the yellow arch that is coming down now. You can see the peak of it around 18%. And these are outpatient visits, by the way. And the thicker magenta line is SARS-CoV-2, which you can see has been going up now since November. And the darker blue line that comes up to around 23%, that represents influenza. And even though there may be a little dip downward, that is the least reliable data, and it's only 1 point. We don't know whether that's really going down. It probably is not. Um, so the influenza is mainly a threat to the very young populations and the older populations. It's H3N1 strain that is responsible for this year's yearly epidemic, and the vaccine this year is very well matched to that strain. Testing is available at the county testing sites and many clinics. There is a combined rapid flu and COVID test, but those are only being distributed by the federal government to the skilled nursing facilities. So the third virus that we're dealing with is COVID. And so this makes the third virus in what we're calling the triple demic. And it has begun to rise now and is predicted to surge in the last weeks of December and into January. Remember, if you remember from last year, Northern California and the rural community rates have often come later than the rest of California. And since testing is significantly decreased this year compared to prior years, the projections are less certain. But we are able to confirm more now using wastewater surveillance, which is a new public health tool to enable us to see what's happening in our communities even before many people know that they're sick. And it's less dependent, of course, on personal testing. Ukiah is now online for wastewater surveillance, and Willits and Fort Bragg wastewater systems are soon to follow. The variants that are more infectious now and escape some treatments are here, but thankfully none are more virulent. And although the viruses escape some of the monoclonal antibodies, the treatment Paxlovid is still very, very effective for those who develop COVID. Next slide, please. For those of you who are interested in the numbers, as of the 13th of December, the test positivity here in Mendocino County is 7.4, but in California, it's actually higher at 11.7. So we are, again, better than the state now in some ways, but it may just be that we're lagging behind the state and we'll catch up. The number of cases reported is ranging between 8 to 10 per day. Hospitalizations are about 4 to 8 per day on average. On Thursday, yesterday, it was 4. We do have one outbreak in the county at a skilled nursing facility. As far as schools, there have been a high rate of absences, extremely high, around the time of the Thanksgiving holiday and a little before that. But when they had their recess, they came back with still high, but not extremely high like it was before. We do have a higher absentee rate again now, and the schools are planning to distribute those home testing kits for students and staff to use before returning to school after the winter break. And of course, if they're positive, those people know to stay away from school at that point. The total number of confirmed deaths from COVID remains unchanged in Mendocino County at 136. Next slide, please. Combined flu and COVID hospitalizations are expected to reach high levels statewide, seen in the 2021 fall Delta peak. And that is the large red lump that's to the left of the white line, but not quite reach the levels of the winter Omicron surge. And so that's a good thing. Also, proportionately this year, when we see those peaks in the hospital, they will be more influenza than they were in the past. Because, you know, in the last couple of years, influenza has been almost nil in our communities. Our hospitals are seeing significant increases in the emergency room and in the clinics. They're also high visit numbers. And so we do expect more admissions will follow. And I've made an advisory, and we've published on the county website an excuse form, because it's overwhelming to providers to fill out forms that are just needed for just clerical work needed for employers and schools. So if that's all people need, we want them to try and use the self-attestation form that's on the county website. Not all schools and not all employers will accept it. So I just want the people to keep that in mind. But this was an attempt to try and make it easier to return to school or work without competing for time with other sick people in the community who needed their appointments. Again, though, if you're having severe symptoms, or there's significant concerns of what the cause is and whether you need a treatment, see your provider. This is not meant to keep people away from their providers. It was meant to ease up so that providers can continue to see people with infectious diseases, but other illnesses also in their clinics and in the emergency room. Next slide, please. So this slide is that slide of California showing the different counties in what community risk level that's been assigned by the CDC. And until yesterday, we had been a county that was rated low. Until yesterday, we were up with the other orange counties intermediate. But overall, the state is mostly in the intermediate and some high in Southern California. However, yesterday they changed us from intermediate to low. So just to review requirements for masking and so on, in the state, healthcare facilities, hospitals, nursing homes, outpatient healthcare facilities require universal masking by state law. At the intermediate level, what is added is a requirement for universal masking in corrections, homeless, emergency, and warming shelters. And at the intermediate level, universal indoor masks in public spaces are strongly recommended, though not required. It's especially strongly recommended for those who either are or may live with someone who's more vulnerable. So even though the CDC changed us from intermediate a couple of weeks ago, yesterday to low, I advise continuing to wear masks in indoor public places. I'm a cautious guy and I want to enjoy the holidays. So I wear a mask indoors to prevent all the lingering viral illnesses that are out there this season. And so you can see actually on the left, you can see all the red, which is high transmissibility, and the different shades of orange that are intermediate. On the right, you can see how this is affecting California and each of the regions. And you'll notice this brown ragged line at the bottom shows that our Northern California rural areas are probably having less admissions than in the rest of California. And the interesting thing is this green dotted line that goes across where the Rancho line is 10% above the baseline numbers. And the other dotted line is 15% and 20%. When these counties get to 20%, it's really a stress for those healthcare institutions to have the staffed beds available. And so we worry as these counties are approaching from 15% to 20%, we're keeping an eye on them. It does look like, for example, in Southern California, the top blue line looks like it's coming down. We can't really rely on the short end of these graphs because they're the least reliable. We don't have the data, and you need usually you had 3 or 4 dots for them to be reliable trends, and we don't have that yet. So moving on, the recommendations now include vaccinating, of course, and getting the new bivalent boosters now approved and recommended for all people down to 6 months of age. That happened in the last couple of weeks. And these bivalent vaccines are well matched to the circulating variants, which the older vaccines and older boosters were not as well matched to, and therefore the immunity was waning. That was one of the reasons for immunity to be waning. So these vaccines, remember, decrease the duration of illness, the severity of the infections, including hospitalizations and deaths, and they decrease, more recent research shows that they decrease the severity and the prevalence of long COVID, very important. Next slide, please. We may not have that at this point. Let me just go through that the vaccine coverage is increasing, but very, very slowly. So the Department of Public Health continues to have vaccines for COVID and flu, 12 years old and up at the fairgrounds in Ukiah on Fridays. And for the last several weeks and this coming Saturday, we will also have it on those Saturdays. In the future, we don't have Saturday clinics set up as well. Do we have, yes, here we go. Good. Thank you. Also, this week on Tuesday, we're going to have a children's vaccine clinic for children down to 4 years old and up at Alex Rohrabaugh Center, Tuesday again from 3 p.m. to 7 p.m. I should say also we have really appreciated the home testing that's been available for free from the federal government, but it was not renewed for a while. They're now seeing this triple demic coming in. The federal government is releasing more COVID home tests, and so that can be obtained by requesting it through covidtests.gov or call 1-800-232-0233. Free tests are also available, of course, at our neighborhood health centers, as well as CVS, Walgreens, some independent pharmacies. And remember that only administrative charges can be made and none to those on public programs. So insurance and Medi-Cal, Medicare also will pay for 8 home tests for each person covered each month. So just to review my advice for the holidays, we all want to have fun. Get vaccinated. Get vaccinated for both COVID and influenza, and they can be done at the same time. Get tested, and if positive, or if you're sick, don't get others sick by going to parties where other people can get infected. And also, if you're positive for COVID or for flu or sick, get treatment that can be prescribed by the clinics or some telemedicine, Sesame Care. We've given that number out in the past, and it's at the bottom of this slide right now. And it decreases your risks of severe illness, death, transmission, and long COVID. Mask up indoor public spaces. This prevents both COVID and influenza and the myriad of other germs. Cover your coughs and wash your hands often. And we all want to have a happy and safe and healthy holiday season. So I'll stop now, and if there's any questions, here to answer them.
Great, thank you, Dr. Coren. And we do have a few questions from our Facebook comments. First one is actually quite a long one. So with the recent press releases about the self-attestation form and recovering at home from flu and COVID, they are not mentioning masking. So why are all the press releases not encouraging masking anymore? And what's the current recommendation?
Well, I think I went through the recommendations a minute ago. We definitely want people to use masks at this point. It shouldn't be missing, but we were trying to emphasize for those people who are sick or have sick children, how to identify, for one thing, if they are really at risk for more serious disease, and use that as a guide to go to the doctor's or emergency room if they need it, and if they don't, how to recognize the danger signs where somebody may be sick and should be going, even if you think you're healthy enough. So we weren't emphasizing at that point prevention that includes masking, but you're absolutely right. Masking is an essential and a very effective way to prevent all these viral infections.
Great. And the next question is, what does test to treat mean?
Oh, good. So it can be very hard to get your treatment and get into a provider's office to get the treatment. And the treatments need to start, or they're most effective if they're started. For example, the Paxlovid for COVID works much better if you get in and start that by the 5th day. And the Tamiflu, which is the treatment for influenza, there's some alternatives to that, but your influenza treatments work better if you actually start them within 2 days. So in order to overcome the delay in getting people's treatment prescriptions, the state developed a program and an initiative where we want to get people tested, and if they're positive, they can rapidly get treated. So certain clinics in our community which did not have the Paxlovid medication on hand could carry some of the medicine, or they could prescribe directly to a local pharmacy. And those pharmacies were identified, and we stocked them through public health resources. And as we found that too was a barrier, we wanted to make sure that the clinics knew which pharmacies had it, and that the pharmacies really were available, and that they would take a called-in prescription for it easily and get that available, so we could get people treated rapidly. In addition, we have our OptumServe testing sites in the county, and they were outfitted not only with the ability to test, but with a nurse who could take a history and get online right there and talk to a provider and get a prescription called in for those people for whom it was appropriate. So the Test to Treat program, which was initiated at the state public health level, was to facilitate getting these treatments to people. People weren't aware of it, or their providers didn't have the time to do it or didn't know to do it. We're still encouraging providers to give those treatments out when they're appropriate, because the effectiveness of them is very clear. It's like if you had a strep throat now and you went to your doctor, but the doctor didn't know they could use penicillin or whatever it is, the antibiotic that they could use, we would have a lot of unnecessary numbers of people suffering from strep throat. So we don't want to have that. So we made it easier to be treated right after you're tested and screened, and if the treatment is appropriate, to get it to your pharmacy.
Thank you, Dr. Coren. And the next question is, will there be updated bivalent boosters at the upcoming December 20th event for kids under 12? They're saying they have been available since October 12th, but we cannot find them anywhere in Mendocino County.
So the bivalent vaccines will be available on the 20th, and they'll be available for children down to 4 years old. That's at the Alex Rohrabaugh Center. Isn't that the event that they're talking about, the December 20th event?
Exactly, yeah. Alex Rohrabaugh Center.
We haven't had the vaccines for the younger people available as much at the fairgrounds, because it's quite frankly hard to get vaccinators for children at that age. So we've had to recruit a group of people who felt comfortable vaccinating the younger children, and that's why we're doing it on the 20th, and we're doing it later in the afternoon so that their parents who are working can also bring them in.
Thank you. And I believe you touched on this next question a little bit, but what can I do if my child's school doesn't want to receive the self-attestation form? He's missed several days. Oh, go ahead.
Yeah, no, that's a great question. And I was just on the phone with the school superintendents in Mendocino County this morning, and they helped me out here. So they, by state law with the Department of Education, can only allow children to have excused absences up to a certain number per year, and I think that's 10. After that, they really do require a physician's or nurse practitioner, provider's note to get them back. Now, we're trying to get further into that during this crisis, but at this point, there are some schools that certainly will accept the self-attestation, and some businesses that will, but others may not. So we wanted to make it available. And it certainly would be better if even 5 of the 10 people who would usually go to their clinic were able to bypass that and hand in a piece of paper they can get on, they can get the form for which online. It is not an attestation or how should I put this? It's not something that the county itself is responsible for. We're making the form available. And we've asked the schools and employers to honor the patients and the parents who believe that their children or themselves are well enough to return to class or to work. And so it's just a form for them to do that. But in many cases, and we also ask them to honor them as much as they can. So I know some of the employers are honoring them and some may not be. And some of the schools and situations will. There are some children who've just been out so many days that the school feels more comfortable if they've seen a provider first.
Great. And I see a question here about where can I get free COVID tests for my family before returning to work or school after the holidays? I know we touched on that as well.
Yeah, so it is available through the government at this point. Here it is. Someone put up that slide for an instant. Good. Free at-home tests at COVID. See at the bottom here. Well, this person may not be online. I'll read it to you. COVIDTESTS.gov is the website to request those free tests, or you can call 1-800-232-0233. The other thing is that insurance companies have that program as well. So you can request from your insurance companies to get free at-home tests.
Okay, and I'm seeing one more question here. Just referencing your previous answer, what do you mean by people are uncomfortable giving vaccines to children or uncomfortable
Oh,
vaccinating?
oh, that's a good question. So not all of us are capable of doing everything. I'm a family practitioner, got trained in a lot of different fields and areas. But even when I was in practice on my own as a family practitioner and in my office gave vaccines to the youngest of children, there are many providers, your internists, OBGYNs, and others, and their nurses may not feel comfortable giving a small child a vaccine. Will they hurt them? Will the kids move? How do they stabilize them? How do they talk to them so they're not afraid? And so it's not the easiest thing. And many people don't want to give a child a vaccine. And so we have to find professionals who are licensed and who feel skilled and confident in giving these vaccines to small children.
All right, we have one last question that just popped up. And will there be adult vaccines available at that clinic at Alex Rohrbaugh Center on Tuesday?
I think it is. Maya, do you know, or Evelyn? I'm pretty sure it's from 4 up.
Yes, I believe so. I'm
Good.
just looking at the flyer. So yes.
So come one and come all. Bring your kiddies and bring your grandparents.
Great. Well, I'm not seeing any more questions at this point, so we might have an early ending. Dr. Coren, do you have any closing comments or recommendations?
No, I do want to reiterate my thanks to everyone in the community for pulling together. We have done a good job. We've had a lot of loss, and we're sorry about that. But pulling together as a community, I think we have done a great job, and I want to extend my thanks to everyone who's participated. And I do want this to be a healthier, happier season. We do have a lot of viruses circulating. Some of them are nothing more than your usual virus, but even in the years where people get usual viruses, some wind up very sick and hospitalized. So take care of yourselves. Again, the best universal protection you can get at this point is wearing a mask when you're indoors and around people who you don't know. And then, of course, if you can prepare yourself with vaccines, that goes a long way to protecting you and protecting the others around you because you don't pass it along. And if you do happen to get sick, again, use our advice in terms of if you're sick enough to be able to be, or who needs to be seen by a provider, go ahead and do it. Or if a child seems to be having any of the danger signs, we want them to be evaluated and treated. But again, the best thing is to be wearing masks and prevent all this with vaccines the best we can. And eat well, get your exercise, breathe a lot of fresh air, and really enjoy the holidays.
All right. Well, we want to thank Dr. Coren for his time and for tuning in. And thanks to everyone that listened and asked questions. We'll continue with our third Friday of the month, Media Day. So that means January 20th, Friday at 2 p.m. will be the next one. And in the meantime, you can go to our Facebook page or the Mendocino County Public Health website. And if you have questions, you can call the call center 707-472-2759. So we'll see you all next time and have a great weekend.
Bye all.